I am 18 years old. Am I receding? I would like to know if I'm receding or maturing in the hairline. My hair is indeed wet in this picture in natural lighting. I figured it would give better judgment. Could hormone imbalance cause such a thing in a specific area? My hairline has always been at this height. However, the corners look to be thin. Also, my hair texture is extremely different from my father. Would that make a difference in the extent of hair loss? P.S. My hair is combed in a backwards direction.
Thank you for your question. You submitted a single photo and you state in your question that you're 18 years old and you're inquiring on whether or not it appears that your hair is thinning. And you state that the photo was taken with your hair wet. You're asking about hormone imbalance being a possible cause. You describe some family history, and it's basically you're looking for guidance as to first the diagnosis and then, of course, the management. Well, I can certainly give you some guidance from my practice. I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Hair loss treatment has been a significant part of my practice. In fact, I am the founder of TrichoStem Hair Regeneration Centers. This is a technology we developed to treat men and women with hair thinning using an injection, a non-surgical alternative to hair transplant, as well as what's becoming a significant alternative to the taking of oral drugs, such as finasteride. And I'll go into the details of that a little bit further, a little bit later. So to begin with, I think that you are probably becoming aware of some recession and thinning of your hair. What is important is to first answer the questions that come to your mind. And of course, yes, hormone imbalance may be an issue, but in my experience for men with young onset hair loss, it basically falls under the category called androgenetic alopecia, or genetic pattern loss, something that runs in families. Common myths that it runs from the maternal uncle side or maternal grandfather, but the reality is there are multiple genes that are associated with hair loss, and therefore, even if it's siblings or other family members, you can't figure out how this occurred, it is in the genetics. And of course, when we do an evaluation for someone like yourself, we take photos with the microscopy, we take standardized photos, we review your medical history, your medications and details, and if there's any question or concern, we'll either refer you for endocrinology evaluation, or if there's any question of the diagnosis from a tissue perspective or what exactly is going on, whether it's male pattern or something else, then we'll do biopsies. And that means taking a piece of the skin with the hair to diagnose what's going on from a microscopic point of view. However, I would share with you that the overwhelming majority of hair loss, 95%, for both men and women, the most common diagnosis at 95% is androgenetic alopecia. So the question becomes, what do you do moving forward? Well, when we started doing this treatment called hair regeneration, and briefly, hair regeneration evolved from our application of wound healing technology using this material called acellular matrix that recruits adult stem cell activity to further improve the wound healing for hair grafts as well as the donor area of hair transplants. We were able to find that thinning hair got thicker. From this, I developed a process called hair regeneration. And what we do is for men and women at almost any age, and our youngest male patient is 17, we are able to successfully, with a single injection treatment, stop progression, restore the growth of hair that hasn't been growing, as well as induce the shed of thinning hair so that thicker hairs grow in. You have to understand that hair thinning is a combination of the cessation or stopping of hair growth and the progressive miniaturization or slow progressive thinning of hair. And for men, there is a strong association with something called DHT or dihydrotestosterone. So you're kind of on the right track in terms of a hormone-related issue. But what happens is, with puberty, the testosterone levels goes very high, and that means that also the dihydrotestosterone increases. So people who have DHT-sensitive hair can also be treated with a drug called finasteride. Unfortunately, a lot of people don't want to take finasteride because of current fears about long-term sexual side effects. Once we were starting to pick up a lot of momentum with the hair regeneration treatment, and we have patients who come from all over the world to come for this injection treatment, which currently stands at 5 years out, no evidence of regression for the vast majority of patients, which means one injection treatment. And in some cases, in the past couple of years, as we started treating more and more people, and we saw some situations where we wanted to experiment with additional injections, an injection at 0.0 and an injection at about 15 months continues to be extremely successful in helping people treat their hair loss without any other drugs or other interventions. We found younger and younger people coming, and there were often times when I had to really question whether or not it was the appropriate thing to do to help someone as young as 18. The point is that the onset of this type of hair loss at a young age is unfortunately associated with a certain rate of progression that doesn't make you the best candidate for a procedure like a hair transplant. So, understanding that you now have drugs on one end, like Propecia, which people are afraid to take, and you're not a good candidate for hair transplant, it is of value for you to learn about an alternative like hair regeneration, because this is using your own blood, your platelet-rich plasma, which is the concentration of growth factors. But unlike platelet-rich plasma on its own, we have combined it successfully in an algorithm and a dosing process and a delivery technique with acellular matrix to successfully treat men and women of a wide range of ages with progressive hair loss. So certainly discuss this with your physician, discuss this with the people in your family who can assist you in finding the information, and do some consultations, learn about what options you have, and so that you feel comfortable with any decision you make. And I think this is something that will help you also think of the different options, and there are not that many. So timing is important. I stress this very much when it comes to hair regeneration treatment. When we have situations where people can start losing hair at 18 and be bald by the time they're 22. It's a very aggressive progression. So the earlier we catch someone, the better it is. And this has been a very strong message that we have developed for our patients, for people who are learning about this, that the inventory of hair is the limiting factor, the inventory of salvageable hair follicles. So the earlier we catch someone, the better it is. So learn more about your options, start doing some consultations, try to get into doing something early so you save the hair before it's too late. So I hope that was helpful. I wish you the best of luck, and thank you for your question.